Good morning. I'm Rosalind Pryor, and I'm a licensed educational diagnostician as well as a speech and language pathologist in the state of Texas as well as in the state of California. And so I've had the ability to work with students on many levels, both in private schools, public schools, hospital settings, and via telehealth, as we are doing right now, or virtual classrooms, teleservices. So I want to talk to you about something that's near and dear to my heart today, and some problems that we are going through since we have gone into this pandemic. This pandemic has had a virtual devastating effect on children, minority children, and children that are in lower socioeconomic groups. So the pandemic is affecting our future through the effects that it's having on our teachers and especially our children. I want to start with some statistics that I've gathered and one statement. Although healthcare workers are extremely essential to us getting out of this pandemic, and they are. I have worked in the healthcare industry, and I can tell you that they are extremely essential in us coming out of this pandemic. But we also have to look a little further into this pandemic and how it's going to affect our future by affecting our children. Basically through the miseducation of our children who are in the lower socioeconomic groups, those children who are minorities, and those children who fall into the special education categories such as autism, intellectual disabilities, orthopedic disabilities, learning disabilities, and so on. So these children are being extremely negatively affected with virtual classrooms. They are not getting what they need in the virtual classroom setting. They are not having the education that they were privy to before the pandemic, and it's not even close. These children, we're talking about children who desperately need one-on-one assistance that they were getting before. They need a person that is standing next to them, who is able to guide them and teach them. Teachers are essential. I'm going to say that again. Teachers are very, very essential. Now, the Pew Research Center says that 20% of all public elementary school teachers in the U.S. are racially and ethnically minorities. That means that they have a greater risk at getting COVID-19. There are a higher percentage of teachers from minority and racial ethnic groups in city schools, which is 31%, than in suburban schools, that is 18%. So the Department of Education and the National Center for Educational Statistics says that we have 37 million teachers in the U.S. based on statistics from 2018. So 79% of them are white, 6.7% of the teachers are Black, and 9.3% are Hispanic, which is a rising number. So we have, based on that, a significant amount of teachers that are at risk for getting COVID-19 in the classroom, and they are getting COVID-19 in the classroom from children. Because children may not be sick themselves or show overt signs of having COVID-19, but they are passing it on to the teachers, and the teachers are getting sick. When a teacher gets sick, that affects the whole class in which they're teaching, or the whole cohort. schools are developing cohorts. So that affects the whole cohort. And that cohort has to then self-quarantine for 2 weeks, 10 days to 2 weeks. And so then you have those kids that are out of school. So a lot of the cohorts include those children, and that's a good thing, that need extra attention. But again, the kids are going in school only to get exposed to COVID-19, or their teacher get exposed to COVID-19, only to come back out again for another 2 weeks, and then go back in for another 2 weeks to come back out again for another 2 weeks. That is not an education in which these kids need. And that is going to greatly affect and cost the U.S. Dollars in the future, because these children are losing a year to 2 years. Children already lose when they go through summer break, and it takes them anywhere from 2 weeks to 6 weeks to just on a regular basis just to gain what they have lost. So we're talking about kids who left school in March, may not have gone back to school until August, and so they've lost 5 months, 6 months, and now they're only having virtual school. So they may be going to school, in school 2 days, out of school 2 days, in school 1 day, out of school 1 day. That is not the education that these children that are at risk need. And again, if you look at the teachers and the statistics with the teachers, 28% of the teachers in elementary and secondary schools in the United States are over the age of 50, which puts them again at risk for getting, higher risk for getting COVID-19. So the UN, the United Nations, says that at least 24 million students, I'm going to say that again, at least 24 million students across the world could drop out due to the pandemic. And I can tell you, I have first-hand knowledge of this. We have had several students in the districts that I worked in, that I am currently working in, that have students that are missing in action. We have no idea where those students are. They didn't show up for the beginning of school. We can't trace them down. Some of them have been sent out of the country. Their parents were not able to find work here in the United States. So this is a huge problem. So teachers, I'm going to say it again, teachers are essential, and they need to be part of phase 1 or phase 2 of the vaccination process within the United States system and around the world. Unless, if we do not do that, these children will not be able to come back to school. It will affect the economy, because then the parents will not be able to go back to work. And the parents are not able to adequately teach the children. They're not trained the way the teachers are to teach these kids the way they should be and the need to be taught. There are, if you look at teachers have underlying conditions. 1 in 4, according to AARP, 1 in 4 teachers have underlying health conditions that make them at higher risk for getting COVID-19. So there are many, many variables here that in education that where teachers need to be in phase 1 or phase 2 in getting the vaccination for COVID-19. It is a must. Nearly 1.5 million teachers in the U.S. are at risk for getting COVID-19 just based on their underlying conditions. Now let's talk about the kids who have underlying conditions, especially special needs children. A lot of special needs children and a lot of kids that are not special needs children have underlying conditions. These kids need to be vaccinated. Now, I know that we are not testing the vaccines right now on children under the age of 12. But when we do, these children that have these special underlying conditions and have special needs, they need to be first in line. Or we're going to have a generation of kids that are not going to be able to function. They're not going to be able to be prepared for life. They're going to need extra help to get where they need to be, and they're already behind. So we have some problems also with virtual and distance learning. You know something? We need virtual and distance learning right now. I'm not knocking virtual and distance learning because we need it. There is no other option for us right now to even give these kids a chance. But there are some legitimate problems with virtual and distance learning, and I know them from a first-hand basis. First of all, parents are not information technology specialists. As much as we would like them to be, they are not. They cannot handle all of the problems that go along with having virtual education. They don't know Zoom platforms. They don't know how to correct, go in and talk to the IT specialist and get the problem solved. They're having to take, if they're able and they have transportation, they're having to take the laptops or the iPads or the Google platforms up to the school in order for the school to help them right there on the spot. Or even worse, we're having to have teachers, a set of teachers. The only thing they do is to go out to the school, go out to the homes to help the families get on the computer, help them get on the hotspots, help them to start the classes. And even at that, the kids do not log on the way they're supposed to log on. Problem number 2 is parents are trying to juggle work with being substitute teachers. Parents are not trained, most parents are not trained to be teachers, especially when you're talking about kids who have special needs and need accommodations, modifications. Parents just don't know those things that are innate to teachers to be able to provide those modifications for their students, which is making their students lag even further behind. Many households don't have adequate internet access, even with the Wi-Fi hotspots. We're having problems. Even they don't know how to resolve those problems with the Wi-Fi. If the Wi-Fi hotspot is not working, they don't know how to resolve the problem with the Wi-Fi hotspot. They're relying on, again, calling IT. And it can take anywhere from a day, from half a day to a day to 2 days before IT gets around to helping all the kids that need help in getting back on. And then we're not talking about the problems that are district-wide if the system goes down. We have phone calls coming in like crazy. My child is not able to get on. I don't know what to do. So those are legitimate problems that are happening as we go through this pandemic, and kids, again, are falling behind. There are problems with the virtual classroom platforms, Teams, Zoom. Kids don't know how to navigate these platforms. We had to go from March to kids trying to navigate platforms in April. And some kids in some school districts that are poor school districts didn't even have the capability to move that fast from a regular classroom into a virtual classroom. So again, those kids were left behind. Let's talk about the dropouts again. The kids, the pandemic dropouts, and we're calling them pandemic dropouts. They are coming in numbers. In thousands, in hundreds of thousands. Kids are dropping out just because it is too hard to get online. It is too hard to find Wi-Fi. It is too hard to navigate the computer system. It is too hard to navigate this without someone's attention. They just don't want to get on because there's no one there to supervise them during the day. And then some of them, like I said, are sent out of the country. Some of them are special needs. They're not able to get on. So what do you do when things get too rough and no one's there to support you? You drop out. You stop trying. And that's what these kids are doing. They have stopped trying. So teachers need to be included into phase 1 or phase 2 of this vaccine decision-making process. If they aren't, we are going to have a generation or half a generation of kids that are not going to be able to perform, or they're going to have months and years to catch up. There are kids now that are in their formative years, preschool, first grade. They're supposed to be learning to read. By grade 3, we're going to expect them to be able to read, to learn, and they're not going to be able to do it. So therefore, they are going to be left behind. So the key word here is kids are being left behind because of this pandemic. Again, if you need to find some more information about this, there are several websites you can go to for statistical information, for information on how to help your child. Call your school board. Let them know that you see this problem. Let them know that you have a voice and that you are advocating for teachers getting in to phase 1 or phase 2 of getting a vaccination for COVID-19. And teachers, I want to appeal to you because we as teachers, we as minority teachers, we as minority personnel in school districts, we have got to take the vaccine. We have got to show ourselves as leaders and take the vaccine. We have got to show ourselves as leaders in the minority community, if you are a minority, and take the vaccine, because we need to show everyone that this vaccine is indeed safe, or we will never get out of the pandemic. Our kids will be left behind, and that will become a hashtag, left behind. We do not want that. So make sure that you are doing what you can do in your community, and make sure you are encouraging your parents, make sure you're encouraging your fellow teachers, the principals of your school, the school boards, to have a conversation with everyone regarding taking the vaccine, regarding having a voice in this whole process. Like I said, there are several websites that you can go to. You can go to the Department of Education, ed.gov, and find out information on the pandemic. Of course, you can go to the WHO's website, the World Health Organization.org, and find out information on the pandemic. You can go to cdc.gov, and they will give you information on what can be done in your school district to combat COVID-19, to keep teachers and students safe. You can also go to the United Nations website to find out on a global viewpoint what is going on in the world and what other countries have done to combat this and get their kids back in school. Again, if you like this video, please give it a thumbs up and please subscribe. Thank you so very much.